Hi, Dr. Pelto here. I'm going to go over a condition called Hallux limitus and Hallux rigidus. We're going to spend most of our time on Hallux rigidus because people tend to wait till something gets bad before they come in. But basically, this is arthritis of the big toe joint. You can see here. Now, you have to be sure it's not gout, it's not something else. But I want to explain, initially when you're going to see a doctor, they're going to get an x-ray, and you're going to have pain in your big toe joint. And there's different levels of Hallux limitus. So if it's been diagnosed by your doctor, you can either have mild, moderate, and severe. And the main way I kind of look at it is you want to see joint space in a joint. You see the joint space in these joints. This one has narrowing of one side, and there's a beginning of this right here, which is some lipping. Here there is more lipping on both sides and narrowing of it. This is more of a moderate, and this one is more of a severe where the lipping is much more. And this won't allow the joint to bend right here. And this one's usually severe ones are not painful at all. The mild ones can be a little bit more painful. That's what you look at when you're looking at the x-ray. What are the causes? Well, one of the causes is mechanical jamming of the joint. So that can happen due to your anatomy, and I'll explain there's specifically something we can look at the x-ray in a second. Arthritis can develop this. This is the most common thing. You could even have, let's say, a gout attack and develop arthritis, and then this happens after. And then faulty function is one of the main reasons. What are the symptoms? Well, the main symptom is pain or stiffness when walking, kneeling, or squatting. So people tend not to want to squat down. They tend to have swelling or pain around the joint. You have to determine it's not gout or something else. A difficulty finding shoes, pain when there's cold or damp weather, and it tends to get worse over time. The diagnostic exam besides an x-ray is either an ultrasound or an MRI. What you'll find is joint fluid around the area of the joint. Here's an example of the joint. Here's an example of joint fluid. Another kind of example of an MRI that you could see also spurring in joint fluid on the area. That's the best diagnostic exam you can do for it. I wanted to specifically talk about something called functional hallux limitus, which is reduced joint movement of the great toe when you're walking or when you put pressure on it. A lot of times we put pressure on it in the office and it doesn't move as well. The way I kind of explain it is something that's limited progresses to something that's more rigid. And specifically on the x-ray, we look for this big, this bone right here, a little bit higher up than the other bones next to it. And that can cause some jamming of the joint and spurring over time. There's different things that we can do with an orthotic to help with that. So I'm going to go over this checklist here in a little bit. If you stick around, we're going to go through kind of how you would go about treating this. Once again, this is not for medical care unless you're seeing me, but this is just for educational purposes. So we're going to go over some of the non-surgical treatments, how to stabilize your foot and reduce the joint jamming, reduced inflammation. I'm not going to spend too much time on physical therapy. I don't find it all that effective for patients. A little bit of shockwave or some of these advanced treatments as well. I don't use those as much as either.